We are here this morning to honor and recognize Dr. Michael Mumma with the Lifetime Achievement Award from Sarasota Memorial Hospital for a 30 career of brilliance in the practice of cardiology. No one in the history of the department has ever done as many things as well and made it seem so easy. Michael held full electrophysiology privileges and performed diagnostic electrophysiology studies, pacemaker and defibrillation implantation. He serves as the Chief of Electrophysiology Section. He pioneered the privileging process in electrophysiology and procedural pathways, which have built the strong foundational principles of commitment to quality upon which the program now rests. Dr. Mumma practices interventional cardiology and peripheral interventions for vascular disease. He was one of the founding members of the Direct Angioplasty Saves Hearts Team, or DASH program, which has provided emergency angioplasty and stent placement for patients with acute myocardial infarction since the 1990s. The program revolutionized the care and improved the outcomes of hundreds of patients with acute MI, and today serves as one of the most important programs at Sarasota Memorial Hospital. Dr. Mumma has always been at the forefront of introducing new device technologies into the cath lab, as well as cardiac research, serving as principal investigator for many trials. His commitment to evidence-based integration of new technologies remains a cornerstone of the current interventional program. Michael's training at Duke University's undergraduate program and School of Medicine serves him well. During his many years in the Cardiovascular QI Committee and as section chief, he brought his academic and principled approach to each meeting. Dr. Mumma also brought his expertise to the structural heart program as one of a handful of physicians performing transcatheter aortic valve replacement and mitral clip, as well as Watchman. Michael brought a commitment to a team approach and technical skills to the development of this highly successful program. Dr. Mumma is the only physician in the history of Sarasota Memorial Hospital to hold privileges in practice in all three disciplines of electrophysiology, interventional cardiology, and structural heart. The practice of medicine, however, is both an art and a science. The ability to bring scientific principles to the art of human interaction. A discussion of Michael's scientific abilities tells only half the story. His ability to relate to his fellow physicians in a collegial fashion and offer assistance on a difficult case or situation in the cath lab by bringing a calm, competent, reassuring expertise in emergency situations is well known by his peers. His warm-hearted personal empathy allows him to truly listen and relate to his patients and individualize their care. These priceless gifts for successful human interaction and technical skill makes him highly sought after by patients in private practice. His patients are his best referrals. They enthusiastically send not only their friends, but their family members to seek him out as their physician. Dr. Mumma brings his energy, intelligence, and integrity to the sickest patients in the county by serving as medical director for the Congestive Heart Failure Clinic. This award-winning program addresses the needs of patients suffering from severe heart damage and offers them the opportunity for improved quality of life and survival. Throughout his career, Michael has participated in coverage for the community health clinic and cares for patients regardless of their ability to pay. Everybody has a warm and personal story to tell about Mike. He's had many activities: fishing, boat captain, pilot. He always has carried a warm sense of humor. He has cared for me, my mother, and my father. He's been my partner for over 25 years and my close friend. I believe that I share the same sentiments with the physicians and staff in this room and those throughout the department, that we have all been lucky to know and work with this exceptional man, that the best is yet to come. Thank you, Dr. Michael Mumma.
Thank you, Dr. Fox, for those kind words and for being my partner for the last 25 years, as you said. So a couple weeks ago, I got a text from Alyssa Schulman, Chief of Staff. It said, "This is Alyssa Schulman, open parentheses, Chief of Staff, close parentheses. When you have a chance, please call me." I said, I don't think I'm going to hurry to answer that phone. I'm being called to the principal's office for some reason, and that doesn't. And then she sent another one and said, "It's all good, I promise." And so I called her, and she gave me this news, and I was dumbfounded and speechless and teary-eyed. It doesn't take much to get me teary-eyed, but it's certainly not an award I ever expected to get. And it gave me pause to think about a lot of things. It's been a tough 14 months since for both me and my wife, since I received my diagnosis, and it's given me cause to think about a lot of things. and you think about what you've done with your life and you think about your legacy, and you never think about getting an award like this. I mean, you think about, did you help people? And I think in interventional cardiology, we uniquely help people, a lot of people that we can see the results right away. I think back to one of the first patients that I did on the DASH protocol, came with an acute myocardial infarction, and she was 91 years old. And we hadn't been doing direct angioplasty very long, and she rolled into the ER, and she was in extremis, and there was no family. And should we take her to the cath lab, or what should we do? And we took her to the cath lab, and we fixed her. She did well. She went home a couple days later, and about 6 months later, she succumbed to non-cardiac causes. And when you wonder if you've helped people, her daughter made an appointment to see me. And she made an appointment to see me just to come in and say, thank you, you gave me 6 months with my mom that I wouldn't have had otherwise. And it really brought into focus what we do in interventional cardiology in particular. And I think I could probably, if I had a reasonable memory, which I don't, I could probably fill a book with those kind of stories about patients that we really helped. And I think about what's changed since I started working here 30 years ago. By the way, that's the first thing that the Lifetime Achievement Award makes you do, is it makes you feel old. Lifetime. I mean, okay, lifetime. And things are so much different in the practice of cardiology. Dr. Graper's here. He remembers we weren't even putting in defibrillators when we started that, and we started putting them in with these big old honkers in the abdomen. And you know, today we've progressed to the point where we have cardiac resynchronization therapy with these little devices in the pectoral region. It's one of the three things that I think we've really, really dramatically helped people with in cardiology. The treatment of heart failure we now have 4 drugs we put everybody on for heart failure, and we didn't have any of those drugs when I started here. Beta blockers are the foundation of heart failure therapy, and if you put somebody in a beta blocker 30 years ago, it was malpractice, because we all knew it was a negative inotropin effect of the heart. So stents, we didn't have stents when I started here. We were barely doing angioplasty. I remember one of my former partners putting in the first stent here, a Gianturco Rubin stent, and I sat and watched it, and I turned to one of the techs in the booth and I said, that's the stupidest thing I ever saw. That's never going to work. So I wasn't always an early adopter of new technology.
We thought so too.
I'm sure you did. You still do. So, you know, when I think about getting an award like this, I think about all the people that are responsible for it, because it's not just me. There's lots of people in this room that are responsible for it. You can't practice interventional cardiology in a vacuum. I would even, I think I would even go so far as to thank the administration, because through, I think, 5 different CEOs here, I've seen this hospital has always, although we always have our differences between physicians and administrators, this hospital has always done its best to provide us with the opportunity to give patients the best care possible. And I can think back when we started the TAVR program, we were losing a lot of money in every patient we did, and they gave us the go-ahead and said it's a program we got to have and you got to do it, and now we have one of the most successful TAVR programs in the country. I think the other big thing that's changed is the collegiality among cardiology and cardiologists and cardiac surgeons here. When I first started here, there was 2 cardiology groups, and the thought of 2 of those people from those 2 groups sitting in a room and talking to each other, I think it would have made that first debate look like a tea party. It would have never happened. And now we have, for example, TAVR meetings every week where Dr. Yaryur and Dr. Schreibman and myself and all the surgeons and the anesthesiologists sit down and talk about each other's patients and help each other do cases, and it's really a much more collegial attitude that I think gives rise to better patient care all around here. So I said the administration was part of it. I think you have to have other physicians. You have to have kidney doctors when we mess up the kidneys, and vascular surgeons when we mess up somebody's artery. And we have to have thoracic surgeons to really bail us out when things go bad. And we have to have primary care guys to send us the patients and help us take care of them. And so interventional cardiology can't work without that. I would thank all those people. I would thank my partners of more than 2 decades, Jim Fox and Dan Pacifico. You couldn't ask for better partners. Couldn't have done this without you guys. Seriously, you guys. And the person I thank the most is my family and my wife, Marty, who's here. Somebody who never complained, never batted an eye when I got home too late for dinner every night of a week, or get rolled out of bed at 3 o'clock when the beeper went off to go take care of someone. And you couldn't do interventional cardiology unless you had someone like that. So I will just finish, thank goodness, by saying, sorry. I said this award means so much because it comes from my peers, and that's why it's unlike any other award, and it's unlike any other stories I can tell. My colleagues and my peers are giving me this award, and I can tell you it's humbling. And for the rest of my days on this earth, I will cherish this award, and I thank each and every one of you.